Hi everybody, I am Dr. Katie Schmitt. I am the physical therapist here at Hollings Cancer Center. I am here today with the wonderful Carol, and we are going to show you some neck exercises. These are isometric neck exercises, so you're not actually moving your head, but what you're doing is you're turning on your neck muscles for side bending, for rotation, and you're making the whole neck stronger. Carol can tell you, they probably seem very silly, and they're little, but they're super effective. So the first one we're going to do is resisted side bending. So you're bringing your head to your side, but you're going to put your hand right up here on kind of right above the ear. I'm going to put my hand right on Carol's head right here. Yep, and you're going to press into me and hold and relax. We're going to do 10. Press and hold and relax. And 3, relax. 4 and relax. 5, relax. You want to make sure that you're pressing it enough where you feel the muscles turning on, but you're not going into any pain. Press and relax, and press and relax, press and relax, and press and relax. Beautiful. And now we're going to do the other side. So if you're at home, you're just going to take your other hand, put it right up, right above your ear. Yep, let's do it. You're going to go ahead and press and relax, and press and relax. And as you can see, Carol's head is not moving a whole heck of a lot. You want this to be a small motion, almost like there's no motion at all, especially if you've just gone through a surgery or radiation and you're feeling very, very painful. We're not going through a whole lot of motion, so it's protecting the neck, but you're still getting all of the muscles to turn on, you're getting them to fire, and you're getting them stronger. I think you're on 8, but I'm not sure.
I lost track of listening to you.
Good. If you've watched any of the other videos, you know I can't count. So we'll stop right there. We'll call that 10. Now we're going to do rotation. So this is the one where you're looking over your shoulder as if you're driving, something like that. You're going to put your hand right up on your temple. So I'm going to put my hand right here, and you're going to turn and rotate towards me and relax. 2 and relax. 3, relax. 4, relax. 5, relax. 6, relax. 7, and you can see I'm just barely giving her resistance, but it's enough that I have to kind of fight her on each movement. Good, and relax. No pain, right?
No.
Fabulous. I'll let you do the other side. Bring your head up. Good. 2, 3. And especially if you've had radiation bilaterally, these sternocleidomastoid muscles, the muscles right in here, might be very irritated and very tight or fibrotic. But the more you do it, the more you're going to get your strength and your control. Driving is going to start to be easier. Looking to listen to people talk is going to start to be easier. And your neck's going to feel a lot better. I think that's 10. Good. So now we're going to do flexion. So you're putting your head or your hand right on your forehead, and you're trying to look down. So I'll let you do that. Yep. Go ahead and press down. Good. And I want you to barely move, and I really want you to think about just small neck muscles. The shoulders are not doing the work. All the upper trap muscles in the shoulder are going to try and do the work. We don't want them to. We want those little small muscles that might have been irritated or moved around because of whatever surgery you've had to come back nice and strong. 2 more. Beautiful. All right, now we're going to do chin tucks. You can do these up against a wall. You can do them sitting in your car with your head against your headrest. I'm going to grab a pillow because I want Carol's head to be nice and stationary against the pillow. I don't want, again, these upper trap muscles to do the work. So pretending I'm your couch. Oh, hold on. Keep your head right up there. Perfect. Now just tuck your chin in just a little bit. Good, and relax. And tuck in. We're going to do 10 and relax. What you want is just the muscles at the front of the neck to start working. It counteracts the muscles at the back of the head that might have been pushing you forward because of being on the computer or being on the phone or because of any position you might have been stuck in when you were in the hospital. Good, and you're pulling back almost like you're a turtle, pulling its head back into its shell, or like you're smelling something that doesn't smell right. Good. You have 2 more. The chin tucks According to the literature, you should be doing 60 a day. So split them up, do 30 in the morning and 30 in the afternoon. Good, and relax. All right, the last thing that we're gonna do is some stretches. So we're gonna do an upper trap stretch and a levator scap stretch just to get everything to relax. So upper trap, ear to shoulder, and you're just kind of letting it hang out there. You essentially want to hold this for a minute. So if you have to pause the video, please do, because I'm not timing us correctly. You can put your hand on the top of your head. You can put your arm right behind you and get more of a stretch. Totally up to you. Again, making sure there's no pain involved in this. Now you're going to turn your chin and look towards your armpit. And now the stretch goes more into the shoulder blade. This is the levator scap stretch. This one, especially if you've ever slept wrong and you've woken up with a stiff neck, that's this one. You're just gonna breathe into it, allowing the muscles to open, giving them time. Slowly come on out of that. Go to the other side. Ear to shoulder. I'm gonna do it with you because it feels good. Just letting the whole thing open up. Again, if you've been through radiation, if you've been through surgery, things might be tight here. You can take your other hand and you can rotate back and forth on those neck muscles, kind of like you're strumming a guitar string, just to get them to open up a little bit. Go ahead and bring your chin now towards your armpit and feel how the stretch moves just a little bit. That's perfect. Ideally, you want to do the stretches 3 times a day for a minute. You want to do the neck isometric exercises, 10 to 20 repetitions, and the chin tucks you're shooting for 30 to 60. This does not take the place of medical advice. So if I've given you this for homework, awesome. If your oncologist has given you this for homework, awesome. If not, please reach out to your oncologist or your physical therapist just to make sure all the exercises you're doing are safe. You can come on out of that. There we go.
Okay.
Yay. All right, thank you so much for doing neck work with us.